Same jacket. You know, at my age and stage, when the jacket fits, you wear it, right? Well, hi, everybody. It's wonderful to be back in the House of Representatives again, where I served 10 years on the Energy and Commerce Committee and the Merchant Marine and Fisheries Committee, and loved it very, very much. And when I was in the House of Representatives, the Maryland delegation, at that time there were 16 women in the House, and 25% came from Maryland. It was Connie, Bev Byron, Gladys Spellman, and me. How about that? That was really an incredible group of people. Well, this is indeed a fantastic celebration, and I wanted very much to be here to join in with my colleagues to commemorate it. I want to acknowledge another sister from Maryland, my own dear friend and esteemed colleague, Congresswoman Donna Edwards. And I want to thank the Congressional Women's Caucus on Women's Issues, as well as NIH, for organizing this most important anniversary event. An anniversary event that commemorates the past, says what we're fighting for today, and how we have to stand up for the future. Remember, savor the past, talk about what we're fighting now, and stand up for the future. I remember 25 years ago, I had been recently elected to the United States Senate. When I ran for the Senate, they said I didn't look the part. Well, friends, this is what the part has come to look like. But on this great anniversary, I'd like to read a letter that sparked a revolution. This letter was signed by Pat Schroeder, Connie Morella, Olympia Snow, and Barbara Mikulski. It was 1990. It was August. The Gulf War had begun. George Bush, the elder, was in the White House. The Hubble was getting ready to be launched. Little did we know it would need the most expensive contact lens in American history. And then with my colleagues, I was with Senator Casabelm and I, but with my colleagues in the House, there was yet one more GAO report that said women were not included in the protocols at NIH. That the famous study called Mr. Fit, whoa, studied 10,000 medical school interns and residents, and not one woman was included. And in the meantime, the National Institutes of Aging, located in Baltimore, had just completed a longitudinal study on aging in America, and not one woman was included. And I said, my God, Strom Thurmond was aging differently than I was. So we put our heads together across the aisle and across the dome, and we wrote this famous letter. We are writing to propose a meeting between the members of the Executive Committee of the Congressional Caucus on Women's Issues and key government officials to discuss women's health. We hope that this meeting can take place at NIH at 10 o'clock. In addition, we would like the public to be able to attend. The purpose of the meeting would be to provide members of the Congressional Caucus to learn what steps NIH takes to respond to the issues raised by the GAO report and elsewhere, and to discuss with key government officials what steps might be necessary to strengthen federal research on women's issues. We invite Dr. Ruth Kirstein, our beloved friend and colleague, Secretary Sullivan, Surgeon Attorney General Novello to participate. So there we were. It was a hot, steamy August morning. I zipped up in my car. Who was getting out but Connie in her car, living right there in Montgomery County? Out popped Pat Schroeder and Olympia Snow. We pulled up. The cameras were there. The cameras were clicking, and they said, have you heard? George Bush has just appointed Bernadine Healy as as head of NIH. We said, first step, but not the only step. Don't give us a new woman and the same old policies. And we met that day across the aisle, across the dome, with the key scientist, and we had listened to all the ridicule. We couldn't do it because our reproductive rhythms might skew the research. We said, screw you. Skew, not skew. The second thing was there was a doctor then at Hopkins who's since passed on. I had nothing to do with that part. And he said we had raging hormones. And my response was him, you're right. Our hormones rage because of guys like you. Well, to move on with the story, again, that particular day, we asked what was the scientific reasoning. We found that there were a lot of excuses, but no scientific explanations. We asked for changes to be made. We were broadcast out over the entire NIH campus. We asked for goals. We asked for timetables. And we got the commitment from Dr. Rabb. And then we were able to begin the long step of moving forward. We always had a very able, dedicated ally in Dr. Ruth Kirstein. She was always there for us, even when the bureaucracy tried to impede us. And then with Dr. Healy's arrival, and Senator Kassebaum helped with the confirmation. She got there, and we said, Dr. Healy, we need an Office of Women's Health, not a new institute. We don't need an institute on gender. We want to cut across every single institute, whether it's aging, whether it's heart disease, whether it's on all of the other fabulous institutes there. We want to be included in everything. And we also need you to pay attention to breast cancer, because while young women are racing for the cure out there, we need to be doing the research right here. Well, guess what? I went to my colleague, Senator Ted Kennedy. Connie and Pat and all were working the energy and commerce and the appropriations over here. We had wonderful people like John Dingell and Henry Waxman and others on our side. And as the appropriations process moved forward, we put in the Office of Women's Health. We did it because of Ted and Nancy on the Health Education Committee, because of Tom Harkin and Arlen Specter, again, across the aisle, hands across the aisle, and the House worked with us. And then, as that moved forward and we established that, I got a call from Dr. Healy. She and I were becoming quite close as we worked on all of the issues related to NIH. And she said, Senator Mikulski, I would like to do a longitudinal study on hormone replacement. It is an accepted medical practice, but I think our basic assumptions could be wrong. But I can't ask for money because of the chain of command at OMB. And I said, and I can't do earmarks. That's before they were banned. Bad mistake there. But anyway, but we never earmarked at NIH, nor should we. So then I went again to Ted and to Nancy, to Arlen and to Tom. We figured out a day. Again, our colleagues in the Congressional Women's Caucus were right there to work the authorizing and the appropriations process. And we found a way to do report language that gave Dr. Healy to do her study. Well, you know the rest is history. We established that wonderful the Office on Women's Health that has meant so much in research, that has meant so much to include young women scientists who never got a shot, never had a chance on that opportunity ladder. Now we see not only our beloved Dr. Vivian Pinn, who Dr. Healy appointed and had the foresight to do that, plucked her out of her great job at Howard University and brought her to NIH. So we had Bernadine, we have Dr. Ruth, and we had Dr. Vivian. What a trio. What a turbo team. What a turbo team. Well, Dr. Ruth isn't with us anymore, nor is Dr. Healy. But in Dr. Healy's closing days, when I knew she was quite ill, I called her. Because I had read in the New York Times that day that breast cancer rates had been reduced in America by 15%. And I called Dr. Healy, and if I get a little emotional, please bear with me, because when I think about what we did, and calling Dr. Healy, I said, you know, Bernadine, we did a lot of good things, but that Office of Women's Health, with what you championed, what Ruth championed, what Vivian made sure really did happen, the hormone study, changed medical practice. And when they say, well, what did the women ever do? You can say, you know, we saved lives, and we saved them 1 million at a time. So, dear friends, when you commemorate this anniversary that began with this letter, began with hands across the dome, hands across the aisle, not women versus men, but men and women working together for the common good, we really made history and we changed history, not only for institutions, but for the lives of hundreds of thousands of women. So God bless you for what you've done, but that's what we do now. Now let's get the money in the federal budget. Let's lift those caps. Let's fund NIH. Let's get that money in there for the Washington Health, and let's do that for today, and let's stand up for tomorrow. There's more breakthroughs to come, and if we have to break a few knuckles to be able to do it, or a few barriers, so be it. So all of you, God bless you. God bless those absent friends today, and the fact of let's keep the spirit of hands across the aisle, hands across the dome, helping hands for the American people. Thank you very much.